Hello there. My name is Jonathan Friedman, and you are listening to FAQs by EHN Canada. This is a show where we scour the internet for the most frequently asked questions about mental health and addiction and ask an expert for their answers to them. Today, it is my honor and my distinct pleasure to introduce my special guest, Crystal Bell. Crystal is the Executive Director of EHN Outpatient. She has worked in the healthcare service field since the mid 1990s. Crystal holds a Master's of Social Work and has certifications in cognitive processing therapy, seeking safety, and trauma informed leadership. She's dedicated to providing accessible, evidence based treatment. Crystal believes in fostering a culture of safety, quality, and excellence to ensure every client receives the highest standard of care. Crystal, how are you doing today?
I'm great. Thanks, Jonathan. Thanks for having me.
It is a pleasure. I've been waiting for this one for a while, and I'm really excited to have you on the show.
Wonderful.
Before we get into the 5 big questions on the internet about virtual therapy, I would love to know from you,
Mhm.
out of all the fields in the world, why mental health care? You could have chosen anything.
Yeah, it's true. Um, well, it goes a little bit back to just some lived experience in my family, and have come over the years to know many more people that it touches their lives that I'm personally impacted by, as well as some of my own lived experience. So I've lost some family members to the disease of addiction and mental health. So this is a field that hits really close to home.
Thank you for sharing that. I remember when I was doing my child and youth counseling degree and I
Mhm.
got to do an honors thesis.
Yeah.
Um, I got to survey so many people in social work, psychotherapy, child and youth counseling, why they got into the field. And over 90% of them actually had a personal thing that happened to them that made them say, I want to
Yeah.
do this.
Yeah. It's true. In many ways, I did stumble upon it. I was encouraged through some mentors in my life to look into it. I didn't actively seek it out, but I did follow their guidance and direction, thinking this might be a good fit for me. And I have no regrets. I've been doing this for almost 30 years, and it was definitely my calling to do this work.
It's fantastic. And
Yeah.
thanks again for sharing that, Crystal. It's now time to get into our 5 big questions on virtual treatment and virtual therapy.
Mhm.
So, firstly, what is virtual treatment? What does it look like?
Yeah, well, virtual therapy is very much like what we're doing right now, where people log on to a link and they come in and they start to engage in a conversation and dialogue about why they need to be or want to be in therapy and start working on some things that maybe have brought some concerns for themselves and they want to address and live that kind of quality, meaningful life that they deserve. And we want to work together to help them to get there.
Really interesting. And I think myself, like, I've been going to therapy for years. And when I started going to therapy, like, as an adult,
Hmm.
um, before COVID, I would go take the bus after work
Hmm.
and go to my therapist's office, and I had the warm walls, the
Right.
lights, the comfy chair. And then COVID really said, "Hey, all right, if you want to continue therapy, then you got to do it virtually."
Right.
And I'm wondering, I know how I feel about it. I'm
Mhm.
wondering, is virtual therapy as effective as in-person sessions for treating mental health and addiction? What are you finding?
Yeah, I mean, that's a really good question. And you're right, Jonathan. The world kind of experienced this collective trauma of COVID, the pandemic at the same time. And a lot of services, not just therapy, moved to online, but a lot of commercial services as well of other treatment services. And so we started to pivot and adapt to that. But then there was this flavor of okay, now we're back to normal, whatever that is, post pandemic. And a lot of services started to move back to in person, but many services remained virtual, one of us being one of them, but we were even EHM was even virtual before the pandemic. But we grew our virtual programming, and what we know really is that virtual therapy is just as effective as in-person sessions. So there's been numerous studies that have shown comparable outcomes for us in areas like anxiety, depression, and substance use disorders, which we treat. And really, what it tells us is the key factors in any effective treatment, whether it be in person or virtual, is really about that therapeutic relationship between the client and the therapist. And then also the client's level and willingness to engage in the therapeutic process. And then also whether or not the platform that you're on really allows for that privacy for the person to show up and have that space to engage in therapy. So for some people, really that convenience and accessibility of virtual sessions is what drives them to consider it. And we also know that it can actually improve participation and retention in treatment for people.
That's awesome. That's really interesting. And it sparks so much for me. And one of the first questions that comes up is, how do therapists build rapport and trust through a screen?
Mhm.
I know when I was doing my child and youth counseling, like there's so many things that you notice when you're in that space with that person you're working with. There's body language, there's the way we're moving, the environment we're in,
Mhm.
but there, on a screen, that's all sort of like
Yeah.
literally cropped out.
Mhm. Yeah. Yeah, you're right. And when we think of that, in person has some advantages where we're really, we can engage in observing a bit more of what goes on below the waist. The toe tapping, the fingers moving if people are anxious. And so that is kind of eliminated from the screen. But there are many ways for therapists to really engage and assessing where a person is at with their depressive or anxiety or substance use system. So there's, specific questions that we would ask, and the therapists really do rely on many of these same tools in virtual therapy as they do in person. So, the key things like empathy and active listening and taking into consideration cultural sensitivities and just being that reliable person that always shows up for them. They also really take extra efforts to check in about how the virtual environment is working for the client, like what more might they need to feel comfortable in the setting. So we're really listening and being highly responsive to what the client would like. They're also mindful of crisis situations that could happen in a virtual environment and how they're going to talk through those situations, and when do we need, that immediate support for people. So like in-person environments, where there's established safety protocols, we also really consider those in an online setting because we have to consider risk for any emergencies that might come up. So we know the client's location, we know their emergency contacts. Those are really essential pieces before engaging in virtual therapy. And then we can also utilize in our setting what we call as support counselors to really assist that primary therapist with being a response if that person requires that in their home setting. Because our goal is always to build the rapport, build the trust, and then ensure that there's care and safety in this environment. And so our therapists do a really good job at it. Many of them are doing it for many, many years in this online setting.
That's awesome. Thanks so much for sharing, Crystal. I know for myself, what like I've spent so many hours. At first, I think I was kind of skeptical when
Mhm.
I started my own virtual therapy journey.
Yeah.
And it's really been life changing. And one of the pieces that I really love about it is I can access it from anywhere. If I'm on a work trip or something like that, I
Mhm.
can still access therapy just by making an appointment, which I really, really love.
That's right. Yeah.
Even more even more accessible in that way.
Yeah. The accessibility is really key and why many people choose the virtual option.
Amazing. So, walk me through what maybe a first session or first couple of sessions would look like? You finally taken that step to try therapy maybe for the first time. Um, what does that process look like?
Yeah, so I would say it's a big step just, committing to therapy and showing up. So that's already a strength. So when the person first logs on for the virtual therapy appointment, I would say that the therapists are really looking at this as a chance to get to know each other. So the client also wants to know a little bit about their therapist. What do they bring? What years of experience do they bring to the table? And maybe what even is their background in the work. So they're building that relationship before they really start to dive into the work. The therapist is going to really, start to ask them about what's been going on in their life. What is their history? What brought you to therapy, right? And really ask them, what do you hope to get out of this? Because the therapist works for the client and with the client. And so the client really needs to drive the goals and their outcomes. And so the therapist is really going to lean into that and work with them. And while they're bringing many skills to the table and all the tools, uh, the therapy is really led by the client, and then the therapist is going to work with them to meet their needs and their end goal. So they're going to really know early on what's the timeline of the work that we're doing together, what are the goals we're hoping to achieve, and we're going to work towards a discharge from the start of getting the folks there. So before any online session, I really would encourage people to think about finding that quiet, private space in their house and making sure that their technology is working before the session starts. And, really like, don't try to, prepare anything fancy for your first session. Just come as you are and just know that being there is a really big deal, that first step, and just let it flow naturally and let the therapist get to know you and start to build out a plan where you're going to work together collaboratively to help you reach what you're hoping to get out of therapy.
That's fantastic, Crystal. Thank you so much. And something I notice when I'm searching for a therapist, and I've heard from my friends and my colleagues, like even when we were going through your bio, we see cognitive processing therapy, seeking safety, trauma informed. We see all these terms, and different therapists will come to the table with different tool sets. How do you know in that first session that, okay, they're presenting XYZ, maybe they're
Mhm,
struggling a little bit with anxiety, but they also feel low sometimes? How do you
mhm,
know and say that, together we're going to go through a cognitive behavioral therapy plan?
mhm. So one of the things we do at EHN too is outcome based care or measurement care. And so we're really looking at what is the primary concern. So through these tools, these validated tools, we're going to know what is the most primary concern, but we're also going to hear the narrative from the individual. Then, based on those, we know which evidence based tools that you use to treat certain mental health symptoms, right? So, we know cognitive processing therapy is an evidence based treatment for trauma or PTSD. So, we might say to the person, hey, this is a type of modality that we use to treat this. We know it's effective, there's good outcomes. Is this something you would like to lean into and try? And let them know all about what it's going to look like, how long it's going to take. It's a very structured program. You have to have buy-in. You kind of have to have the client's permission to start that process. It's a very intense process. Just like if you're working with somebody with substance use disorder, and maybe that's their primary concern and why they're there, you might say, you got some trauma in your life. The primary concern is substance use, and this is a modality that blends those two very nicely. And so I would recommend that we move forward with a seeking safety approach. And this is what you can expect. This is what can entail. This is going to be the homework. Is this something that you would like to start? So it's this mutual agreement of knowing what you're going to move through. And it's going to be guided by any diagnosis that they might bring, any outcomes, measurement tools that we use, and then what the client's willing to proceed in. They usually do rely on us as, kind of the experts in what treatment modality to move towards, which is really helpful. but we do have to have their permission to engage in that process for sure.
It's really interesting. It's I think an interesting piece of it is that like when you're online and Googling and
Mhm,
searching for different therapists,
mhm.
you're greeted with this barrage of
Yeah.
different treatment modalities. And it sounds like it's really like once you make that choice, like, hey, I feel like I like where this therapist is going. Let's have that consultation call. Um, it's really up to the therapist to say, okay, hearing everything, I think this
Mhm.
is a good approach to start. Here's what that looks like. Here's what that
Yeah,
actually looks like, and offer clear definitions and
that's
process of
right.
it.
Yeah, absolutely. Yeah.
Really interesting. So, what are some common myths? That's really hard with my lisp. What are some common myths or misconceptions about virtual therapy that you often hear from clients?
Okay. Well, we have quite a few. Um, so if I think about um, some of the things that I've heard about virtual therapy is really this idea that some people might think it's less effective than in-person therapy, or somehow it's less serious. Um, but the research consistently shows us that is equally impactful. And then again, it goes back to that stuff I was speaking to earlier around how important the client therapist relationship is. And that can translate very well in a virtual setting, just as well as an in person setting. So, another misconception too is that um, virtual therapy is really only for people with mild concerns. And and our team, we really work with clients facing that wide range of challenges, including trauma, which I've spoken to, anxiety, depression, and substance use. And we use all those evidence based treatments. So some people will worry that well, maybe virtual therapy will feel impersonal. So, as we've talked about earlier, it's really important for a therapist to create that connection from the start, getting to know them in that first session, creating that safe and intimate space where they can feel um, that therapeutic rapport building and they can settle in and move through the therapeutic process. And that if they're also in a group setting, it's really important to help them build the peer connections. And then another belief that we sometimes hear is if someone is really struggling out in their personal life and at work or in relationships, that they automatically need residential or inpatient treatment. And so that's not always the case, right? So we want to use those outcome measures to really assess that level of severity for people. And many people, based on those outcome measures, even if they're like the moderate to leaning towards severe, they can progress significantly well in an outpatient virtual setting where the approach is evidence based, it's consistent, and it's personalized to their needs. So the level of care really should match the need, where the person is at, what the person is willing to do. If they have different barriers in their life preventing them going to in person, how can we see if the virtual therapy environment is exactly the right place to start for them? So we take all of that into consideration and we really help people kind of move through some of those myths and misconceptions around the virtual therapy because it could be a really good fit for them. And it's an opportunity for therapy versus not having therapy.
And I think too, it sounds like there might be like a first understanding we have about
Mhm.
the mode of therapy,
Right.
inpatient, virtual.
Yeah.
Um, but it's really about a great therapist being able to hear your story and say, "Hey, based on what I'm hearing, I think we can create uh, a great system of care if we do these things."
You want to really work with the person to see what is it that you need and how can we help you um, and build that safety around them because that's always in mind in a virtual setting for sure. What supports do they have at home? Um, do they have that safe, private space? And what will we do after hours if a crisis comes up, right? So you're always thinking of safety planning and building that in. It's not always required, but it's an important conversation to have.
Totally. Very, very interesting. Crystal, it's been a pleasure to have you on the show. If you were to give someone a small piece of advice for when they're starting their own recovery journey, what advice
Mhm.
would you give them?
Um, well, I would say that everyone deserves to live a life of peace and meaning. And whether we're struggling chronically or going through something that's momentarily in life, um, we deserve to move through a system of support like we do for all kinds of other medical treatments that we might have. We might see our family physician, massage therapist, a physiotherapist, a dentist. You know, our brain health is just as important as other parts of our body, and it's not so scary. There's lots of stigma out there. I know around when we talk about mental health and addiction, we're getting a lot better at it. And I always like to tell people, you know, 1 in 5 individuals live with a mental health concern or a substance use concern. And so you're not alone. And so I really encourage you to take that leap and to take care of yourself because you deserve it and you deserve to live a life free of struggle and get the support that you need because it's out there.
Crystal, thank you so, so much for being on the show. Everyone out there, if you're interested, if you're curious, if you're looking to learn more about the work Crystal does, please go to ehncanada.com. There's a virtual treatment screener button pretty much everywhere at this point. Click it, and that's how you start your journey with virtual treatment. So definitely give that a go, and there will be a link to that in the description of this episode as well.
Yeah.
And to listen to even more episodes of Five Facts, you can check it out on your favorite streaming platform. Crystal, thank you so much, and we'll see you all next time.